Welcome to a CUNY TV virtual roundtable discussion, COVID-19, a crisis in motion. I'm Mike Gilliam. Hardly seems possible, but the coronavirus pandemic has been with us and dictated our lives for about 6 months now. We've endured lockdowns and stay-at-home orders. Businesses have been forced to close. Some may never reopen. Millions of Americans are unemployed, while their continued benefits are tenuous at best. The most fortunate workers were able to keep their jobs, but many are working from home. Schools closed and switched to remote learning, and tough decisions are being made about the start of the new school year by both educators and parents. Transit systems are still relatively empty. Manhattan looks nothing like it did just 6 months ago, with streets and sidewalks no longer teeming with a crush of humanity. And office towers hold far fewer workers than before the pandemic. We wear masks to help stem the spread of the virus. Professional sports are back to some degree with no crowds, and it's not clear how long that's going to last or what sports will go forward this fall. Will there be any college or pro football? The answer to that question is certainly up in the air. As we head into the fall, we thought it would be a good time to take stock of where we are now and where we're headed as we transition from summer and into the fall. To help us better understand the forces at work and where we stand, we have an excellent panel, including the Deputy Director and Chief of Partnerships at the Education Trust New York, Bryant. From the CUNY Graduate School of Public Health and Policy and a Forbes magazine contributor, Professor Bruce Y. Lee, MD. We're also joined by a middle school teacher from Bronx Community Charter School, Keith Andre, and the distinguished professor of epidemiology at the CUNY School of Public Health, Denis Nash. Welcome to all of you. Denis, let's start with you. The numbers have been good in New York for the last month or so, and we've been reopening. Are we truly in a position, though, right now to reopen our public and private schools?
Well, thanks, Mike. I think we're in a pretty tenuous place, and we need to proceed, very cautiously. We have to be sure that we can control community transmission, and that's going to be the best way that we keep any schools that are planning to reopen safe. And then once we can keep community transmission low, once we feel confident that we can do that, and I think we've been doing a pretty good job with that in New York. I'll come back to that in a second. Then we need to think about how we prevent transmission from happening within the schools. It's inevitable that there are going to be kids and teachers exposed to coronavirus while they're in school. There will be people with the infection at the schools, but there are measures that can be taken that within the schools to prevent transmission from happening there. And that is the critical thing that I think is going to be a challenge. And some of these things relate directly to resources and infrastructure, like a good HVAC system for air circulation, like personal protective equipment and the ability to keep kids and teachers and staff physically distant. I think these are challenges, these are new challenges, and all this has to happen while schools are delivering learning and curriculum. So I think it's tenuous. And coming back to the community transmission thing, though, it does remain to be seen what's going to happen over the next few weeks. There's a lot of people returning to New York City or coming to New York City for the first time for college. There's going to be people returning from vacations from all around the country, some of whom coming from hotspots. And we need to make sure that that doesn't result in too big of a spike in community transmission. And that's also critical for school reopening.
A lot of tough decisions need to be made at this point. Parents are making them, politicians are making them, also teachers. Keith, what's the word as far as teachers are concerned? What are you hearing from your colleagues, yourself? What do you feel about going back to the classroom?
Well, our school made the decision about a month ago. I'm at a public charter school in the Bronx. They had been following all the CDC guidelines as best as they could, given their budget constraints. And our school decided to pull the plug on in-person instruction in September, about a month ago. So as it stands now, we are going back fully remote in September, and all the professional development that we do leading up to September. And as it stands, we will reevaluate the situation, or leadership will reevaluate the situation in October. But currently, our union chapter is in the process of negotiating what that would even entail. For instance, what would push us over the hump of like going into a different model for teaching right now. But I think the overwhelming reaction of my colleagues is that we don't think that it's safe in the current conditions.
So you would be reluctant to return to the classroom?
Yeah, and I think it's safe to say that most of my colleagues, based on a survey that union members filled out and that we saw results to, it seems that most of my colleagues feel that same way.
Mm-hmm. Yeah, you've worked a lot with equality in schools and that sort of thing. What do you see as far as this situation that's developing right now? Do you have concerns that this might not be equal for all students across education?
Yeah, definitely, Mike. I think there are many students who were already experiencing extreme inequity prior to the pandemic. I worked in New York City as a teacher, principal, at district level leadership for 16 years. And some of the conditions of schools and the learning and just how students with disabilities experience schools, how our multilingual learners experience schools, the inequities have always been pervasive. I think that those inequities were then exacerbated by COVID-19 and the conditions and how it hit certain communities. And so there's no doubt that there is serious inequity right now as we think about returning to school, but also, things that we need to be very attentive to as we think about planning for reopening. Everyone's not starting from the same spot. Some folks have experienced death and loss in droves. We've lost principals, we've lost teachers, we've lost students, and both the academic and non-academic parts of school will be so important, and even more important this fall than they've ever been. And so I do think there's extreme inequity, and we have to think through how we try to sort of close gaps and bring folks up to par as we reopen schools.
Bruce, you always have your finger right on the pulse of New York City. What are you hearing about the populace in general and their feelings on the reopening, especially of schools?
Yeah, there's certainly a lot of concern amongst teachers and families and students themselves, because I think one of the challenges here is a lot of the talk in general has been, reopen versus not reopen schools. And we have to keep in mind that it's actually a continuum. So schools have to be able to demonstrate that they can handle all of these different issues, and not all schools have the resources of doing so. And so if you have a school that can't follow all the CDC guidelines, and schools have to be very transparent about it, because to be fair to the students, the families, as well as the teachers and staff, there has to be a fair amount of transparency. What exactly can you do and what can't you do? Can you social distance everyone? Do you have the proper amount of PPE, et cetera? And one of the concerns is people are not hearing this information from their schools or the school districts, or at least there's uneven information coming out. So these decisions have to be made at an individual school basis. So you can't just blanketly say, okay, reopen all schools, because as Dia mentioned, not all schools have the resources for the entire student body, and we have to look at the entire student body. It's one thing if there's a sliver or a certain percentage of students who have the means to buy masks themselves or social distance, et cetera, but that doesn't apply to all the different populations. So the dialogue needs to change, and it needs to be more about, okay, if we're going to reopen a school, what needs to be in place? And as Dennis alluded to, it's not just the school itself, it's the community. Are we having transmission there? Do we have things such as test, trace, and isolate programs in place so that you can quickly box in the virus? That's really key. Like, the virus is going to be around. So what happens if you identify a virus quickly and be able to figure out who the effective contacts are, and then isolate everyone or quarantine everyone very quickly? If you don't have that capability from a community standpoint, you can't reopen the school.
I've been reading that a lot of administrators in the New York City public schools and also the teachers union are very concerned, saying that they haven't really been given solid plans on how to do this reopening, and they're not so sure that they have all of the equipment, the PPE and all that stuff that they need in order to do this safely.
Absolutely, it's an issue. I mean, you can't run into it's like running onto a football field without any plan. You know, you have to have a strategy. You have to know what's going on. You have to know what's in line in terms of resources and what are you going to do in different situations. And that is those are legitimate concerns. That if they haven't heard the plan, then you know the plan hasn't been broadcast, and there needs to be a very open communication.
Mhm. Dennis, are you concerned about a second wave?
Yeah, I am a little bit. I mean, to be sure, I don't think we're going to have a repeat of what we had in the spring, where you know healthcare systems become overwhelmed. I mean, anything's possible, but I do believe that the city has learned a lot, and we know what to do when there's evidence that community transmission is beginning to ramp up again, and I think you know we'll do it. But that doesn't mean that there won't be an increase in risk to a lot of people and a lot of different communities. That's the other thing that I think Bruce was alluding to. You know, every school is different, every community is different, and we do seem to have so far like a one-size-fits-all kind of strategy that has been articulated by the city. But we know that that's not how you know it can actually work on the ground when the time comes to really begin to reopen some schools. And so I worry about a second wave. I also worry that it can be more intense in some places than others. And I think we need a plan that recognizes the nuance of what really happens at the lower geographic levels in the city.
On the other side of that, could we have a situation where some of the communities that were hit very hard early on might not be hit as hard this time around because so many people were infected?
I think maybe you're alluding to the possibility of herd immunity, and that there could be decreased transmission because in some neighborhoods there's a higher proportion of people with antibodies to COVID-19. You know, a couple of things. We don't really yet have definitive evidence that even if we were to achieve a level of antibodies that was consistent with the concept of herd immunity, it's not clear the extent to that there is short and long-term immunity to the infection yet. You know, a lot of evidence from past experience with these kinds of viruses, coronaviruses specifically, suggests that there might be, but we don't know for sure. And so then if they do, I also worry that you know this concept of herd immunity doesn't totally apply to New York City, especially when you think about at the granular level, you know, from one neighborhood to the next. The reality is New Yorkers really don't stay in one neighborhood for a day at a time. And so you can have people who are, you know, while they're assuming no one goes in or out of a given community, it works. But in New York City, there's a lot of in and out migration on any given day, several times a day. And so this concept of herd immunity is not, I think, totally applicable to the neighborhood level in New York City.
Dia and Keith, would a vaccine be the game changer that you're looking for to try to start getting things back to normal?
I don't know if I'm qualified to answer that, Mike, but I would sort of lift up from what Bruce was saying a few moments ago. Everything he said was about the virus, right? And about PPE and safety in the school. And I just want to name that that's just one component of schooling. The logistics of running a school from 7 a.m. to sometimes 7 p.m. involves so much that just the energy involved of, you know, PPE and making sure everyone's safe is one component. We're also asking people to manage their anxiety about the virus and to teach and to learn, right? And that's all sort of layered upon the complex environments that they come from, right? So when we think about the various neighborhoods that students come from, I was a principal in East New York, Brooklyn, and it was hit hard by coronavirus. And I don't know that enough PPE and, you know, enough logistics would actually make parents feel confident enough. And to your point about a vaccine, I don't even know that that would make parents feel confident enough to think that their child could learn in an environment like, you know, just sort of showing back up at school.
Mm-hmm. How about you, Keith?
Our school serves a community that's a high percentage of which is economically disadvantaged. And I wonder about, even if a vaccine becomes available, what that would mean for our community, whether our students and families would have access to a vaccine, and not to mention just the effectiveness of a vaccine. That said, I think having a vaccine is going in the right direction of making people feel safer returning to school.
Mm-hmm. Let's broaden the conversation a little bit here and move a bit away from the schools and talk about overall. And we can all weigh in on this. What do you think life is going to look like? When do you think it would return to some sort of normal? Are we looking at sometime this fall when Manhattan comes back to life, or are we talking about early next year?
So, Mike, I actually have something to add to both your previous question and this question about the vaccine also returning to normal. Our team recently published a study in American Journal of Preventive Medicine where we basically built a model of the United States, and we looked at what the impact would be of introducing different types of vaccines, and how good a vaccine needed to be or needs to be able to extinguish the epidemic or the pandemic and return to normal. Because that's one of the challenges. So people talk about the vaccine, you know, when is it going to come? And I think the expectation is, okay, once the vaccine comes, it'll be this magical thing that will then allow us to completely return to normal. And we need to keep in mind that those expectations should be changed. First of all, we don't know when a vaccine is going to come out. And it's challenging to develop a vaccine that actually works and it's safe. So we can't forget that that usually takes 3 to 5 years at least to do. So this is a major rush. And the first vaccine may not be that effective. Now, it's helpful to have a vaccine, but we found based on our study that the vaccine needs to be at least, depending on the situation, 70 to 80% efficacious, or have 70 to 80% effectiveness to be able to actually stop the epidemic or pandemic to a point where you can relax social distancing. And that's a fairly high effectiveness. That basically means that, so if you're talking about 80%, that if you compare 100 people who didn't get the vaccine and 100 people who did get the vaccine, and in the former case, 100 people were to get infected, in the latter case, 80 of those people would not get infected. If you think about it, you know, measles vaccine is more effective. It's in the 90s, but the flu vaccine each year can range from, you know, as low as 20% up to about 50 or 60%. So it's not a given that we're going to be able to get a vaccine that's that good. So what may happen is if we get a vaccine coming out, it may be less effective, but it can help. It can help give you some protection, but we still have to continue to do all these different things. So I would urge everyone to keep in mind that we're potentially in this for the long haul. Even when a vaccine comes out, we can't suddenly just relax, you know, all social distancing. The other thing to keep in mind is, you know, we ran scenarios, and some of those things, like 70%, you need to get almost the entire population vaccinated, you know, for a 70% effective vaccine to be able to extinguish the epidemic. And we know at the very beginning, it's going to take time to get people vaccinated. People have to feel comfortable with the vaccine. And it's not just like, you know, a certain group of people. It has to be everyone. It has to be everyone in different populations, in different demographics. And there needs to be the outreach to get people feeling comfortable about it.
Well, already there's major pushback against a vaccine, and we don't even have it yet, right?
Absolutely.
So when do you see things returning somewhat to normal? Do you see people back in the office buildings in Manhattan this fall at all?
Instead of anticipating return to normal this fall, we should be very careful because we're I think Dennis mentioned the word tenuous, and we're at a tenuous situation in many regards. So not just with the school reopening, but there's a number of other factors that really could drive up transmission.
There are some people right now saying that, in fact, this could be the worst fall health-wise ever because of the layering of the flu onto this virus.
I think it's also going to vary. Like if we are doing a good job in New York City of controlling COVID spread, that's also going to lower the risk of flu because they're kind of spread in similar ways. But we see places that all over the country that are not necessarily giving much attention to controlling COVID spread, and in those places, I think the risk of a seasonal outbreak, each flu and coronavirus exacerbating one another and confusing, basically how the response should move forward, and testing and all that stuff will make things, will wreak havoc. My feeling here is that the contact tracing program that the city has been pushing forward, that it claims to be contacting about 90% of every newly diagnosed case of coronavirus, really should be systematically ascertaining from those cases the likely source of transmission, so that we can say something about, like, okay, of all these cases, how many of them are likely were acquired here in the city? How many of them are people who have traveled outside of the city and come here? How many of them are linked to working in workplaces that may have inadequate personal protective equipment or engineering controls? How many of them are linked to public transportation and outdoor dining? We just don't know. And I feel like we need to have a handle on this so that we can make sure that we have good control of the epidemic before we move into these new phases. So that's one of the reasons why I think it's tenuous. We really don't know our epidemic in New York City right now.
We're just about out of time, so I want to go to each of you right now and just get briefly what you would like to see happen over the next month or so as we head into fall that would make you feel a little bit more comfortable about what's going on here with the coronavirus. Dia, can we start with you?
Sure. I think what would make me most comfortable, particularly about school reopening and students returning to school, is us giving some real intense and intentional thought to how virtual learning happens, because I think it's going to be a part of our lives forward, because I think this virus is a part of our lives moving forward. And I think if we just work on that, we won't be having this conversation about where learning takes place, and we can get a little bit deeper on what children are learning in order to just sort of create some space for them to actually move forward. So that's where I'd like to see energy put.
Okay. How about you, Keith?
I would definitely echo that. I'm happy that our school has decided to be remote in September so that we can focus our efforts on improving how we do what we do remotely. We have spent a lot of energy and budget on making sure all of our students have technology. Still, we have issues where sometimes students don't have access to Wi-Fi. So that's an issue. But certainly what we can do as a school that would make me feel better would be to focus our efforts on how we are delivering like rich instruction through this mode.
I'd like to see us get smarter about how we understand our epidemic and how we use that information to sort of move forward more effectively at preventing community transmission. And I would really like to see advances in the testing arena. Not only, to do a better job with our current testing technology and infrastructure, but I really hope to see some better tests, faster turnaround, things that people can do at home without having to go to a healthcare provider. And that, I think, would be a game changer almost as much as a vaccine would be in helping us feel safer and going about our business. So I'm really hoping for better testing technology and strategies.
Bruce, I'll give you the last word.
Okay, no, thank you. So this is sort of encompasses what everyone said. We need to shift the discussion away from a binary thing, like, oh, the epidemic is good, the epidemic is bad, or close schools, don't close schools. Like when you close schools, you have to have a plan in place, like how are you going to plan out online learning and remote learning and things like that. And similarly, if you want to reopen schools, it's not a matter of just blanketly reopening all of them. You have to make these decisions and you have to communicate the information a lot better and have strategies to account for all the things that was mentioned during this panel. And same thing as what Dennis said, you have to have strategies in terms of testing. Like we have to approach all of this pandemic one day at a time and strategically. You don't enter a football season just say, okay, we're going to win the rest of our games, or okay, we're going to pass, do nothing but throw the ball the rest of the season or something like that. You actually approach it strategically, and we should do the same thing with the pandemic. And we have to understand there are a lot of unknowns, so we might have to adjust from week to week. to see what happens. So the key is really the strategies in place, transparency and greater communication rather than, finger pointing and all those different types of things.
Okay. Well, this is all going to be very taxing. And I think what's good here might not be good in Florida and Georgia. It seems that if we're to get out of this mess, people are going to have to take it on their own to do things that matter, include wearing masks and social distancing. I don't see an order coming from the top. Feels like we are a couple of months from the election, and some are willing to just let this all kind of ride and use it politically. Now, I want to thank our guests, the Deputy Director and Chief of Partnerships at the Education Trust New York, Bryant, from the CUNY Graduate School of Public Health and Policy and a Forbes magazine contributor, Bruce Y. Lee, middle school teacher from the Bronx Community Charter School, Keith Andre, and the Distinguished Professor of Epidemiology at the CUNY School of Public Health, Denis Nash. Thank you all for coming on and helping us prepare for what lies ahead. And thank you for joining us for this special CUNY TV virtual roundtable discussion, COVID-19, a crisis in motion. I'm Mike Gilliam. We'll see you next time, and stay safe.